Acidity. The excessive secretion of acid occurs in certain situations like Zollinger-Ellison syndrome, in which acid secretion is stimulated by tumors in pancreas and duodenum. Major symptom of peptic acidity is dyspepsia. We had already mentioned about dyspepsia, that is indigestion, or frequent regurgitation of gastric contents, that is, and chest burn, നെഞ്ചെരിച്ചില്, പിന്നെ peptic ulcers, that is another consequence of the acidity. Chest burn is a burning pain behind the sternum, usually after meals or during strenuous work. Chest pain normally arises when you consume food after the meal. You feel like a pain in the chest region. The gastrointestinal wall can protect itself from the destructive action of acids and histolytic enzyme. Its mucous lining forms the first line of defense against acidity. The mucus discharged from this lining can dilute and neutralize the acid and thereby protect the gut wall. The bicarbonates brought from the mucosa from other parts of the body can also neutralize the acidity. Prostaglandins, that is lipid soluble long chain carboxylic acids, they will promote bicarbonate production and mucus secretion, thereby indirectly protect the gut wall from acidity. Acidity becomes harmful when one or more of these defense mechanism becomes inadequate or less effective. So the acidity in the stomach is normally they are protecting themselves from the acid destructive actions because they have a very smooth mucus lining, as well as the prostaglandins as well as bicarbonates also help in neutralizing this acidity. But if suppose one of these becomes less effective, then you will have acidity. Identifying and avoiding the factors that are essential for the treatment of acidity is the main thing that we have to do as a precaution. Then we have to choose a suitable diet, that is, we have to exclude spicy, pungent, acidic food. Then smoking and consumption of alcoholic beverages should be avoided. The use of drugs like steroids, NSAIDs, should be avoided. Then those who are emotionally sensitive, those who are engaged in stressful jobs must modify their lifestyle to reduce their mental tension. Antacids may provide immediate and temporary relief of discomfort by neutralizing the excessive acids. Drugs called the hydrogen receptor blockers block the histamine receptors and thereby reduce the gastric secretion of hydrochloric acid, like ranitidine. Now ranitidine is something which has been banned, but earlier it was a common drug which was used for treating acidity. Apart from ranitidine, there is cimetidine, famotidine, nizatidine, etc. Another group of drugs called proton pump inhibitors selectively inhibit specific acid-making mechanisms within the cells. They are omeprazole, lansoprazole, etc. Surgical methods such as vagotomy are adopted to reduce acid production. So these are the different methods by which we can control acidity. Next is flatulence. Flatulence means it is a collection of gas in the stomach or in the intestine. If it is collecting, that is, the gas is formed inside the stomach, it will be expelled out by noisy eructations by the mouth. If it is produced in the intestine, it will cause unpleasant rumbling sounds in the bowel and it will be expelled out from the anus. The presence of gas in the stomach may be due to habitual gulping of air when digestion is uncomfortable. This is common in those who have acidic dyspepsia. They will accidentally engulf a lot of air. The presence of gas in the intestine, that is intestinal flatulence is due to bacterial fermentation. That is, there are some carbohydrates which cannot be digested by the intestinal pancreatic enzyme. That will be metabolized by the symbiotic bacteria in the colon, in the ileum. The product of these bacterial metabolism includes certain gases like hydrogen, methane, carbon dioxide, and some intestinal irritants, that is some short chain fatty acids. Apart from that, there will be hydrogen, that is hydrogen sulfide, carbon disulfide, which is formed from like certain food material like egg, then green peas, sulfur containing food items. All these cannot be properly digested. They will release a lot of gases like hydrogen sulfide and carbon disulfide, etc. When once such gases accumulate, it will cause increased fluid retention, it will cause intestinal motility, diarrhea, cramps, bloating. Bloating means you feel the stomach is enlarged, and it will cause accumulation of gas, flatulence. So these are the result of what happens when you consume these eggs, peas and such items. Gastric flatulence can be controlled by controlling dyspepsia by using certain carminatives. They are medicines which can help in controlling the formation of gas, and also it can be avoided by habit of gulping in of air. Intestinal flatulence can be avoided by reducing the intake of green vegetables, starchy food which tend to decompose. So you can avoid taking such food. Then peptic ulcers. Ulcers are crater-like small lesions in a membrane. They are open lesions or ulcers in the mucous membrane of some areas of the alimentary canal that are exposed to the action of acidic gastric juices. The peptic ulcers in the stomach is called gastric ulcer. Those in the duodenum is called duodenal ulcer. When the acidic gastric juice comes in contact with the mucous membrane, it leads to disintegration and necrosis of the tissues nearby, leading to ulceration. Discomfort, burning sensation in the stomach are initial signs of peptic ulcer. Discomfort and burning sensation in the stomach are signs of peptic ulcers. The prevalence of peptic ulcers vary with sex and age. They are common in men than in women. They get common as the age increases. In India, peptic ulcer is common in South India because there is a low protein diet with plenty of spices. This may be a reason for it. There is no general consensus as to what exactly is the cause of peptic ulcer. An injury to the lining or inadequacy of the mucous defense may be a cause of peptic ulcer. That is, acidity, dyspepsia can be a result. In addition to this, it may result from the hypersecretion of hydrochloric acid and the pepsin, and the lowered secretion of the mucous secretions. Now, what happens is that certain breaks in the mucosa will appear, and that will get eroded and will be deepened by the gastric juice. This may be due to the major factors which stimulates the hyper secretion of gastric juice is due to emotional disturbances, mental stress and strain, protein rich food, overstimulation of the 10th nerve, that is the vagus nerve, smoking, alcoholism, irritable food, then the condiments like chili, pepper, ginger, strong coffee, tea, then irregularity in the dietary habits, skipping meals, etc. will aggravate peptic ulcers. The mucous membrane can resist its own degradation by gastric juice, but in some cases this resistance is lost as some portions of the mucosa is getting dissolved and ulcers develop there. In certain cases, that is, in some cases, climatic condition also influence the occurrence of peptic ulcers. Like in monsoon season, it is seen that there is high incidence of peptic ulcers. Major causes and contributing factors that is responsible for the hypersecretion of the gastric juice may be due to genetic reasons, familial tendency, emotional stress, overexcitation of vagus nerve, smoking, alcoholism, irregular food habits, skipping of timely meals, consumption of irritating food, strong coffee, tea, regular use of anti-inflammatory drugs, chronic disorders and diseases such as liver complaint, emphysema, etc. Or it can be due to Helicobacter pylori, which is a bacteria which plays a major role in causing and aggravating peptic ulcers. Its transmission occurs through contaminated food and water. The peptic ulcer may develop in the lower part of the esophagus or the stomach or the initial part of the duodenum. So we can classify them as three. That is, esophageal ulcers, gastric ulcers and duodenal ulcers. Esophageal ulcer is very rare, whereas gastric and duodenal are common. One in every 20% suffer from gastric ulcer. Duodenal ulcer is 10 to 15 times more common than gastric ulcer. It may develop at any age from 20th year onwards. Gastric ulcer, on the other hand, usually develop after the age of 40 years. Gastric ulcer is rare among women until after their menopause. In general, duodenal ulcer is more common among upper social classes, while gastric ulcer is common in lower social classes. There is also a high incidence of duodenal ulcer among individuals having O blood group. Gastric ulcers may sometimes become malignant, but duodenal ulcers are always benign. People engaged in busy occupations like businessmen, executives, professionals are more prone to peptic ulcers. The danger in peptic ulcer is the erosion of the muscular layer of the gastric and intestinal wall by the action of gastric juice. Then what happens is that it will damage the blood vessels and it will lead to hematemesis. Hematemesis is a condition that it will cause fatal bleeding. The condition in which the peptic ulcers erodes all the way to the through the wall of the that is gastric and duodenal wall is called perforation. A perforated ulcer will allow the escape of bacteria and partially digested food into the peritoneal cavity. This will in turn result in peritonitis. Perforation is another major cause of death from ulcers. High discomfort, burning and severely painful sensation in abdomen are the preliminary symptoms of peptic ulcers. These symptoms usually come 2 or 3 hours after meal or also at night. So that is the major symptom, that is once you have food, after 2 or 3 hours when you have a burning sensation in the abdomen, that indicates it is peptic ulcer. Even at night you can't sleep with this pain. If not timely treated, the pain may persist for an hour or more. The abdominal pain is always accompanied by, not only they will have abdominal pain, they will also be having vomiting sensation. They will vomit, especially in advanced case when there is an ulcer which blocks passage of food from stomach to duodenum. So this is an advanced case that will lead to vomiting. The peptic ulcer can be acute or chronic. Acute peptic ulcer is short-living and it progresses rapidly to a favorable or unfavorable termination. While chronic peptic ulcer is long-lasting, it will persist for months or years. In some cases, ulcers are large-sized or multiple. In some cases, the marked symptoms are altogether absent. Severe cases of peptic ulcers have possibility of 3 complications, that is fatal hemorrhage, hematemesis, perforation and obstruction of the pyloric region due to the contraction of stomach wall in response to ulceration.